It's a fact that exposure to secondhand smoke from burning tobacco products causes disease and premature death among non-smokers. There is no risk-free level of secondhand smoke exposure. The good news is that smoke-free laws are a proven strategy that reduces exposure to secondhand smoke and saves lives. Smoke-free laws also reduce cigarette consumption, increase the number of smokers who quit, and change social norms in favor of tobacco-free lifestyles. In 1995, Utah and California were the first states in the nation to pass statewide smoke-free laws. By 2006, Colorado became the 17th state to enact a statewide smoke-free law. The Colorado Clean Indoor Air Act made it illegal to smoke in work and public places, including restaurants and bars. Since the law passed, Coloradans have enjoyed the benefits of breathing clean indoor air. But the work of creating a smoke-free Colorado dates back much earlier, when local Colorado communities played a key role in achieving success. As early as 1995, the city of Boulder passed a smoke-free law that required all non-hospitality workplaces to be smoke-free. 6 years later, in 2001, the mountain town of Snowmass passed a more comprehensive smoke-free law covering workplaces, including restaurants and bars. In 2003, similar comprehensive smoke-free laws were passed in Pueblo, Fort Collins, and Greeley. And by 2004, the city of Denver began feeling the pressure. Throughout the state, local public health staff, community partners, and advocacy coalitions had demonstrated a commitment to smoke-free communities. It was time for the state's largest city to step up. As expected, there was some pushback from certain members of the business community and elected officials, but an outpouring of public support and pressure from the tobacco control movement statewide resulted in success. Then Mayor of Denver, John Hickenlooper, rallied regional leaders and the Colorado Restaurant Association to endorse and support a statewide smoke-free law. A smoke-free education campaign was launched to educate communities, businesses, and law enforcement agencies on the new state law. Radio and TV ads ran on major networks and on cable, along with print and outdoor messaging. On July 1, 2006, the Colorado Clean Indoor Air Act was implemented, and since that time, some changes to the law have gone into effect. For example, exemptions were added for assisted living facilities to include designated smoking areas. Also, a casino exemption was repealed so that casinos were required to be smoke-free. And most recently, an amendment to include medical marijuana was added to the act in 2010. Subsequently, in 2013, an amendment removed the term medical, meaning smoking marijuana was prohibited anywhere smoking tobacco was also prohibited. Thanks to the Colorado Clean Indoor Air Act, thousands of Coloradans are free from the dangers of tobacco smoke. But there's more work to be done. Many people are still exposed to smoke where they live, learn, work, and play. Since the law passed in 2006, many communities have continued to update local ordinances to protect citizens. For example, prohibiting smoking in outdoor service areas, at public transit stops, and in high-density pedestrian locations like playgrounds and parks. Many communities have worked to expand the smoking perimeter to 25 feet from windows and entryways of buildings. And some communities have even updated the definition of smoking to cover new tobacco products like e-cigarettes. In addition to community policies, organizational smoke-free policies have emerged as employers, colleges, and hospitals have banned tobacco use on grounds. And since the current law does not adequately address multi-unit housing, some property managers, owners, and housing authorities have passed smoking bans in all areas of their properties. As you have seen, the Clean Indoor Air Act was far-reaching and had positive impacts in the state. But many exemptions and gaps still exist that continue to expose too many Coloradans to the dangers of secondhand smoke. Continued efforts to uphold and refine the law are needed, and it is clear that community advocates must play a major role. To access free promotional resources, visit cohealthresources.org.